Hello everyone, I'll be reading now chapter 2 of my journey into the medical field. I've been in the medical field before, but I decided to get back into it. Pretty soon I'll be going to school for nursing. So, now I'm going to be reading Foundations of Patient Care, chapter 2. Understand the importance of verbal and written communications. That's my topic today. Alright, effective communication is a critical part of the nursing assistant's job. Nursing assistants must communicate with supervisors, the care team, residents, and family members. A resident's health depends on the NA communicates observations and concerns to the nurse. Communication is a process of exchanging information with others. It's also a process of sending and receiving messages. People communicate with signs and symbols, such as words, drawings, and pictures. They also communicate through their behaviors. Verbal communication uses spoken or written words. Oral reports are an example of verbal communication. Nonverbal communication is a communication that's without using words. An example: a person shrugging his shoulders. Nonverbal communication also has how a person says something. Body language is another form of nonverbal communication. Movements, facial expressions, posture, and other can express different attitudes or emotions. Different languages. Residents' rights. NA should speak in a language that residents can understand, find an interpreter. Someone who speaks with the patient's language to help. Family members should not be asked to interpret medical information. Pictures, cards, gestures, translations device can aid in communication. The NA should not be used in different language when speaking with staff in front of the patients. Alright, so body language sends messages just as words do. Which of these people seems more interested in their conversation? The person on the right is looking down and with their arms crossed, or a person on the left who is sitting up straight or smiling. Nursing assistants must also make brief, accurate oral and written reports to patients and staff. Careful observations are used to make these reports. An important health and well-being of all the patients. Signs and symptoms that should be reported with is discussed throughout this textbook. Some observations will be reported immediately to the nurse. Deciding on what to report immediately, involving critical thinking. Anything that endangers patients should be reported immediately. That includes falls, chest pain, severe headache, trouble breathing, abnormal pulse rate, respiratory rates, or blood pressure reading. Change in mental status, sudden weakness or loss of mobility. Fever, loss of consciousness, change in level of consciousness, bleeding, swelling of a body part, change in resident's condition, bruises, abrasions, or other signs of possible abuse. When making reports about residents, NAs should also must remember that residents' information is confidential. Only information should be only shared with the care team, not with anyone else. When residents report symptoms for events or feelings, the NA should have them repeat what they have said. He said ask for more information. The NA should ask open-ended questions that need more than a yes or a no. For example, the NA should not ask, "Did you sleep well last night?" Instead, he should ask, "Can you tell me more about your night and how you slept?" This will encourage the residents to offer facts and details. Proper communication. When communicating with residents or patients, the NA should do the following. Remember the following. Always greet the resident by the preferred name. Identify herself. Focus on the topic to be discussed. Face the patient while speaking. Talk with the patient, not with the staff members while giving care. Listen to the respond when the resident speaks. Use positive language and smile often. Encourage the patients to interact with her and the others. Be courteous. Tell the resident when she is leaving the room. Residents' rights. Names and pronouns. Nursing assistants should call the residents by their names as they prefer. Residents should not be referred to by their first names unless they have been asked by the NA to do so. Terms such as sweetie, honey, dearie is disrespectful and should not be used. In addition, nursing assistants should also pronounce residents prefer he, she, he's, her, their, them. When making any report, the right information should be collected before documenting it. Facts, not opinions, are most useful to the care team. Two kinds of factual information are needed in reporting. Objective information is based on what the person sees, hears, touches, or smells. Objective information is collected by using the senses. It's also called science. Objective information is also something a person cannot see, did not observe. It is based on something that the resident reported that may not be or may be true. It's also called symptoms. An example of objective information is Mr. Hartman is holding his head and rubbing his temples. A subjective report is the same situation. It might be Mr. Hartman says that he's having a headache. The nurse needs factual information in order to make the right decision and about care and treatment. Both objective and subjective reports are valuable. In any report which is observed signs and symptoms, with the resident's report symptoms need to be clearly noted. Mrs. Scott reports pain in the left shoulder. It's an example of clear reporting. The NAs are not expected to make a diagnosis based on the signs they observe. The observations, however, can alert the care team to the possible problems. In order to report accurately, NAs must observe the residents accurately. To observe accurately, as many as possible should be used to gather information. Sight. The NA should look for changes in the patient's appearance. These include rashes, redness, paleness, swelling, discharge, weakness, sanguine eyes, or posture, gait, walking changes. Hearing. The NA should listen to what the residents say about their condition, family needs, as the residents speaking clearly and making sense. Do they show emotion, such as anger, frustration, sadness? Is their breathing normal? Do they wheeze, gasp, cough? Is the area quiet enough for the residents to rest? Touch. Does the resident's skin feel hot or cold, dry or moist? Is the pulse rate normal? Smell. Are there any odors coming from the resident's body? Odors that could suggest poor bathing, infections, incontinence. Incontinence is the inability to control bladder or bowels. Breath odor could suggest the use of alcohol, tobacco, or digestion and poor mouth care. For oral reports, the NA should write notes so that important details are not forgotten. When needing a given oral report, unless the situation is urgent, the NA should approach the nurse and wait for the nurse to complete the task it's currently doing. Once the nurse has acknowledged the NA, she can briefly state the message and deliver the written summary if there is one. Waiting until the nurse is done helps reduce the risk of error. Following an oral report, the NA must also document when it's about what, whom, who oral report was given. Documentation should always occur after the report is given, not before. Sometimes a nurse or another member of a care team is in the NA brief or report of residents. The NA should listen carefully and take notes. She could then ask about anything that she does not understand at the end of the report. The NA can restate that what she has seen and told about to make sure she understands. Throughout the NA's training, we'll learn medical terms for specific conditions, medical terminology, made up roots, prefixes. Roots is part of words contain basic meaning. The prefix is a word part that comes right before the root to help form a new word. The suffix is a word part added to the end of the root to help forms of a new word. Prefixes and suffixes are affixes. Affixes are attached to affix to the root. Here are some examples. The root derma means skin. The suffix itis means inflammation. Dermatitis is inflammation of the skin. The prefix brady means slow. The root cardia means heart. Bradycardia is a slow heartbeat or pulse. The suffix pathy means disease. The root neuro means the nerve of the nervous system. Neuropathy means the nerve disease or disease of the nervous system. When speaking with the residents and their families, the NA should use simple non-medical terms. Medical terms should not be used because they might not be understood with the residents or the patients. But when speaking with the care team, using medical terminology will help give more complete information. All right, continue. And telephone communication. Nursing assistants may be asked to make a call or answer a telephone in their facility. Always identify the facility's name, hospital, your name, and your position. Be friendly and professional. If you need to find a person the caller wishes to speak with, place the caller on hold. After asking if it's okay to do so, if the caller has leave a message, write down and repeat it to make sure that you have the correct message. All right. Names. Do not ask for more information do not ask for more information than the person needs to return a call. A name, short message, phone number is enough. Do not give out information about the resident staff or any patients. If someone is calling to give a doctor, order it for a resident. Find a nurse or take a message for the nurse. Thank you for the calling. Say goodbye. Call lights. Long-term facilities are required to have a call light system, often called call lights, so that the resident can help whenever they need it. They are the resident's room and bathrooms. They're in the resident's room and bathrooms. Some have strings or resins to pull, and others have the buttons to push. The signal is usually both light and outside the room, and the sound that can be heard in the nurse's station. A call light is primary way for the resident to call, so they can see the light to hear the sound. They do, even though the resident needs help, is not on their assignment sheet. All residents have responsibility for each NA. NA should respond to call lights in courteous, respectful manner. They must also check each time before leaving a room, making sure the call light is within reach of the patient's stronger hand, and that the patient knows how to use it. Alright, that'll be the end of this section. Next section, I'll be talking about describe barriers to communication. And just a little FYI, I like my job. I like making sure all patients are, most important thing is safety, making sure assisting them to the bathroom, making sure that I do my job precise without causing any additional harm, making sure I practice precautions if there's any COVID or anything like that. Always wash your hands, use gloves. Always say what you're doing before you do something, and always address your name if they don't know your name. And assist them to the bathroom, assist them to the bed. And making sure you always change your gloves, wash your hands, answer call lights. Anyway, it's a good rewarding career. I've done this career before, but now I'm going to take it to the next level. I'm going to advance myself even further than before. Something I should have done before, but now that I've been awakened, now I'm going to fulfill something I should have done before. Okay, everyone, please comment and subscribe to my channel. Have a good one. Bye-bye.